Dear EB community, I welcome you to this short presentation on oral care for people with EB, a patient version. So we are gonna share today a couple of recommendations for people living with EB. And most of these recommendations come from the clinical practice guideline that was published in November 2020. This guideline was produced by a group of 26 dentists from 16 countries in all continents. So we're very happy about this working team of people who really care about dentistry for patients with EB. So if you ever have a more detailed question of what we are presenting today, you can always go to Deborah International webpage to the guidelines section and find the link to download the full complete EB care dental guideline. Now the question is, how do I look after my mouth? How can I keep my teeth and my gums and my mouth healthy? So these are a few ideas. For us, the most important bit is the preventative approach. So we try to prevent disease from happening, which means an early referral. Visit your dentist early on and visit it early and regularly. So we can learn about what to do with the oral ulcers from an early perspective. We can diagnose enamel abnormalities very early, as the picture on the right top, and we can start brushing our patients' teeth early on. The follow-up appointment will be different depending on the type of EB. These pictures are all a girl with severe recessive dystrophic EB. And you can see the first time we were in contact with teledentistry was when she was 2 hours old, and they sent us pictures of her mouth, of her tongue. We got to see her as dentist when she was 2 weeks old. And the last pictures here is when she's 12. So she has been in continuous follow-up appointment. It means she has no caries nowadays. We have managed to get a good mouth opening, and we're managing the space for her teeth as well. The picture on the bottom right side, it's a scanner where we see actually there are more teeth coming there than space available. So we have to plan, and we had to pull out some healthy teeth to allow the next couple of teeth to get a right position there. So we have to plan lifelong treatments. About the clinician-patient relationship, it is so important to have good communication with your dentist. And for us dentists with patients, we have to be honest and trust each other. We have to be honest, saying, if we know or don't know something, I don't know what to do here, or I don't know where you have wounds. Can you tell me where you have your wounds, or which bandages do you use? As patients, you need to tell your dentist if something hurts. Teach them about your skin fragility, because each patient is different. So we want to know about your special skin fragility. How and where can a dentist touch? Which bandages or dressings do you like? Do you like to use any emollients or creams on your skin or your lips before we touch your mouth? You might want to bring them with you. I get to see between 3 and 6 patients with EB every single week. So I've got a couple of lubricants with me in the clinic, but not many dentists get to see that many patients with EB. So it's better if you bring your creams and ointments with you. It just makes us all easier. So here are some ideas. We can use Vaseline, we can use Linovera, we can use different creams and ointments on the skin and on the lips. It's ideal to cover the skin with non-adherent wound dressings, depending which ones you like. You might like Mepitel. We might need to use Mepitac to add some things there. For example, a IV line or something like that. And we as dentists, we don't know much about adhesive removers. So if you have some with you always in your bag, it's always helpful. Tell us about heat and your skin. Does heat affect your skin? Do you need a cool environment and air conditioning, for example? Just be honest and communicate with your dentist. It helps everyone. What about moving or lying in the dental chair? Do you want to pat the chair? Do you have some ideas? Maybe bring with you a blanket or a cushion. Here is a picture of one of the positions that we like to use a lot with young children. So young children, we use this knee-to-knee position where the child is actually on the parent's lap. So he feels more contained. For older patients, position yourself because we don't know if we can lift or help you. We don't know where your wounds are. You can, as I said before, you can bring a blanket or a cushion if you want to pat the dental chair and be more comfortable. And if you need breaks because some of the wounds might be hurting, just let us know. We'll be happy to give you a break or let you change position. For caries prevention, there are so many things we can do. But the most important bit, when you visit us as a patient, you come in every 3 months, every 6 months, or once a year. That is not enough. The most important bit in caries prevention is what you can do at home, because you are with your teeth every single day. You're the one that will really take care of it. We will help you a lot, but you are the one that is there every day. And brushing your teeth is just the most important part of taking care of your oral health. Some ideas to help brushing the teeth: using a toothbrush with a small head, soft bristles, and there are some special brushes. There are actually a couple of them. And I'm gonna say the one that I like more for recessive dystrophic EB, when you cannot open your mouth, when you don't have space for your toothbrush there. Personally, what I like most is the Collis Curve toothbrush. I don't have any conflict of interest with them at all. I just like the way teeth get cleaned when my patients use them. Sadly, you can only get them in internet. It's not too easy, but I work as a dentist in Chile. Chile is at the very end of the world, and we order the toothbrushes online and they get to Chile. So if they get to the end of the world, they will be able to get everywhere. So there is no excuses, because they're online and you can order there and get them delivered everywhere. So try it. If you have issues holding your brush, actually these tiny toothbrushes are quite good, because when you have contractures, you can still hold the toothbrush. But there are also different aids that you can use to hold the toothbrush while you're brushing. And also, it's great if you use these interdental brushes. So here I have an adult patient with recessive dystrophic EB who has dental implants in her upper dentition. And you have to clean the space between each dental implant. And you can do that with a tiny interdental brush. There is no issue using this interdental brush. You can do it easily. It's so important to brush. And there are other things of ways to prevent caries as well. So disclosure solution, which is this colorful red painting that helps you to see where you have dental plaque so you can brush better. As dentists, we can provide you with fluoride toothpaste. We can prescribe fluoride toothpaste. We can provide you with varnishes and other fluoride supplements. We can seal teeth, as the third picture, where we sealed a molar so we don't have dental decays happening on these surfaces. And there are some other ways to what we call arrest dental, to stop the dental caries, such as this black solution here, which we call silver diamine fluoride. I personally like it a lot. It stains the teeth, they get black, but it stops dental caries of getting more severe. So it's actually quite a good option as well. And as I said before, frequent recalls. Visit your dentist often. On this example, Ignacio visited me very, very often when he was a tiny boy, and he still visits me very often. And that is so important to keep our teeth healthy. Now he's in his late 10s, early 20s, and he's wearing his braces with tiny, funny colors, lots of tattoos. And that's one of our patients with dominant dystrophic EB. And he's just so healthy from the oral perspective because we've been able to manage these frequent recall visits. So do visit your dentist often just to make sure we can keep things healthy. I'm gonna give some detailed information on some of the issues that you can have in EB. So first of all, oral bullas and ulcers. It's the most frequent issue in EB, and there are only 2 studies on actually products to reduce the ulcers. One of them is sucral fat suspension, and the other one is cord blood platelet with low-level laser therapy. Both of them showing an improvement in the clinical size and pain related to the ulcers. And also there are a lot of mouthwashes available there. If you choose a mouthwash, please try to look for a mouthwash that is aimed at managing mucositis in oral lesions, because the main issue are the lesions. Don't choose a mouthwash that's aimed at infection or caries, because what we are thinking now is bullas and ulcers. So get a mouthwash that helps you healing the wounds inside the mouth. There's several. So I've got a list here of different mouthwashes, but availability will vary between countries, and the clinical effectiveness will vary among patients. I actually have some siblings where one of the siblings likes one mouthwash and the other sibling likes the other one. So it will vary from one patient to the other. And we have to consider that EB is a lifelong condition. So in 1 year, I might want to use a mouthwash, and the next year, your child might not want to do any mouthwash at all because he's tired. And we have to respect that because lifelong conditions are tiring. But we always have to provide our patients with the option of using one of these mouthwashes when they have wounds. The picture I have there is one of our young patients, and she's actually using Tricks, which is the mouthwash in the middle, and she's using this in a different bottle. She, like, family put it in one of these spray bottles, the ones you buy when you go on an airplane, the small ones, and the family sprays some mouthwash inside the mouth before eating, so she has less pain in her mouth and eats better. This worked out quite good for this family with recessive dystrophic EB. And we have lots of families who've tried that and it works. It might not work for everyone, but I always think it's a good idea to try this so the patient has less oral pain when they eat. Another issue is microstomia, so mouth opening. And there are 2 techniques, 2 things we can do, 2 strategies. One strategy is physiotherapy, which means mouth opening exercises. And the second strategy is surgery, so stricture release surgery. This is a physiotherapy, so daily exercises, and there are several different ways of doing exercises to improve mouth opening. If you do the exercises, you might be able to increase up to 10 millimeters mouth opening. So you can get good results. However, unfortunately, it might return to the initial values if you discontinue this mechanical therapy. So you have to be persistent. The other strategy, the contracture release strategy, is aimed at release the scar bands that are in the commissures, in the angles of the mouth, and in the inner side of your cheeks. It's a challenging surgery. The needs compliance from the patient's perspective with the postoperative exercises. Otherwise, the contracture will come back to the previous mouth opening. But actually, when the patient complies with exercises and combines both strategies, the surgery with the exercises, we have quite good results with this. And the last topic I want to discuss today is dental implants, because it's a question that we get quite often from our patients. There's a whole chapter on dental implants in the EB guidelines, so if you want more information, you can read that. But just a summary, the success rate of dental implants in recessive dystrophic EB after 1 year is 98%. And the benefit of implant treatment in recessive dystrophic EB is benefits in quality of life as oral functioning, so chewing, swallowing, speaking, aesthetics, self-esteem and sociability, comfort, and less soft tissue trauma. So it's actually very beneficial for the patient who have had this treatment done. These are my 2 current emails. So if you have any question, you can just email me skramer@odontologia.utile.cl, or you can also email me susanne.kramer@uniclinic-freiburg.de. Any of these emails are available at the moment. The lifelong email is the first one. And just as a last short invitation, we are currently researching on the enamel abnormalities in junctional EB. So if you have junctional EB and want more information about the enamel abnormalities and actually these resorptions that happen while the teeth come through the gums, you can always email me and I can provide you with information. And if you want to be part of one of these research, you can always send us a message and we can see if we can work together. Thank you very much. I wish you a nice day, and we hope to see you in a next EB meeting or conference. Bye.